Welcome to Backyard Oasis, a podcast designed by and for older adults living in the beautiful Pioneer Valley of Western Massachusetts and produced in the tech studios at Greenfield Community College in Greenfield, Massachusetts. Backyard Oasis reaches out to older adults who seek knowledge to help them live more thoughtfully, healthily, and happily, who hope to inspire others with their ideas, and who serve their communities in the interest of the greater good. We hope you join us frequently in our pleasant Backyard Oasis for wide-ranging conversations with a diversity of people who are growing older and want to talk about it.
Hi, I'm Denise Schwartz, your host. You know what? You have a say in your medication experience. This is something that a much younger me did not know. For so long, I thought that the physician's assistant or the doctor herself pretty much determined the flow of our appointment. The medical professional, I thought, told me what I needed to know, prescribed the meds, if any, that would help me, and then said, okay, see you next year for your wellness check. But no, the appointment with your medical professional should be a two-way thing with two-way open conversations being generated the whole way through. And when it comes to medications that medical professionals may prescribe, yes, we, the patients, have a say in that. We should and we need to set the pace of the conversation about our meds, to ask any questions without fear or embarrassment, get answers that make sense to us, and learn the benefits and risks of taking the drugs that are prescribed. My guest today is Jill Shuman. She's a retired science writer and librarian from the Boston area. She spent most of her life working alongside pharma companies of all sizes as they developed new drugs for rare diseases, better drugs for more common conditions, and vaccines during a pandemic. She's an advocate for people asking lots of questions about the medications they take and for having open conversations with healthcare providers about benefit versus risk. And she's going to give us a list of some of the questions we should ask our healthcare providers. And she's going to let us know some other things that will help us get the best possible outcomes from our medications. So let's start. Hello, Jill.
Hi, Denise.
So let's see. We've put together a list of 12 questions to ask our medical professionals. But before we get to that, I wanted you to explain why it's really important for us, the patients, the consumers, to ask questions. And then after that, just tell us a little bit more about you.
Sure. It's important to ask questions about your medications for a number of reasons. Some of us may take multiple medications and don't want to take another one. And perhaps this is something that you could put off needing a prescription for if that's the way you feel. Some of us feel that, taking a particular medication for a condition, once you learn about the side effects, might not be worth it. These are decisions that you should be making for yourself in consult with the person that's prescribing the medication, not just letting somebody prescribe medication for you. Supposedly, this is something you're going to be on for a while, so you need to know as much about it as you can. Most people do more research into buying a car than they do about learning about their medications.
Oh my gosh. I don't think I've ever really done that, but I'm sure now I will, because I always felt like, the medical professional knew what was best. And I never really knew that I had a voice. So this is really helpful for me. I mean, I would talk to my PCP and everything about things. That was really good. And I'm really lucky. I have one who really will have open conversation with me. But I didn't really know that I could talk about the medications and maybe say, I don't want that. But hey, before we do that, a little bit more about you.
Sure. As you said in your opening, I have spent the majority of my career working alongside the pharma industry. But in full disclosure, I am not a pharmacologist. I am not a pharmacist. I am a longtime consumer of medications and somebody who advocated for, when I was a caregiver, for people on multiple medications who could not advocate for themselves. So I have become very, very interested in this two-way street conversation that people
Yeah,
need
that's
to have.
really a good one. Okay, thanks for the full disclosure. So let's get to those questions and that we want to encourage our listeners to ask when they are in their medical professional's office. I think one of the first things you said, and I'm going to come up with the first question that you gave me that makes a lot of sense to ask, and then it's really going to be you to run down the line of these questions. And when the questions are over, I have some other things I'd like to talk about. So, question one, what does this drug treat? What does it do? And why are you choosing this particular one for me?
Well, that's a really important question to ask, because oftentimes the person prescribing the medication, and again, depending on where you're living, it could be a physician, could be a nurse practitioner, could be a physician's assistant. Pretty soon it might even be able to be the person who works in the pharmacy. We don't
Yeah,
know.
I think.
But what condition is this something that you're already being treated for? And this will replace another medication? Is this a new diagnosis that the prescriber is suddenly more concerned with? How old is this medication? Why is this the best one for me? A good response would be, well, this has been tested particularly in older people, if you're an older person,
Oh,
or
yeah.
this is safe for people who are pregnant, if you happen to be pregnant. So you want to know why this particular drug has been chosen, and it just hasn't been chosen from a list of available things to treat this drug. Because you have to understand the person prescribing is likely looking at a computer that is recommending medications to treat this condition. So you want to know
Really?
why. Yes.
Oh, wow. I didn't know that. I thought it was
Yes.
just like in that person's head because that's what that person learned.
No, the screen will often come up with a list of suggested medications based on the entire medical record.
So, do you think in the future AI will be telling us what meds we should be taking?
I'm not saying no.
Oh my
There is
gosh.
a very likely possibility that down the road, a consumer will be able to access this information on their own.
Oh, okay.
A little scary.
It is scary. Question two, how do I take this medication? Why would
Right.
we have to ask that? I mean, don't they usually have those instructions on the side? But, I've noticed on some of the bottles, they don't really give you all the instructions on the side. So
That's
that's a
right.
good thing to ask. How do I
Right.
take this medication?
Right. If it says twice a day, it'll often say in Latin BID, which means twice a day. So it may say twice a day. Well, is that morning and night? Is that after breakfast? Is that after dinner? Is it 7 a.m. and midnight? Do I have to wake myself up to take this medication? So it's really important. The other thing is that there are some medications that should be taken with food. There are some medications that need to be taken on an empty stomach. So it's really important to ask. And it's important to ask because mistakes happen in the pharmacy too. So you should look at the label in the pharmacy that says the dosage instructions and make sure that's what you heard in the doctor's office.
Wow. I never thought about looking at that when I pick it up at the pharmacy.
Oh, absolutely. You have to look at everything. You have to look at the name of the drug. I went in the other day to pick something up and it was totally the wrong prescription.
Wow. What did the pharmacist say?
He was
Not
very
happy.
apologetic. It was the right category of drug. It was just the wrong drug.
Oh
And
my
I've had it come
gosh.
through in the past where the dosage is wrong. Stuff happens.
Wow. Okay, now I'm scared. Okay. Question three, if I take this drug, can I eliminate something I'm already taking?
Okay, so you go to your healthcare provider and you ask the question, why am I taking this? And they say, well, you're taking this because your blood pressure is higher than we would still like it to be. So and you're already taking a medication for blood pressure. So the
Okay.
next question should be, oh, okay, is this a newer drug? And will this replace the one that I'm already taking? I don't really want to take a larger number of pills.
That makes sense. Okay. If I change my lifestyle, can I postpone starting the medication?
Very good question. And hopefully the answer will be yes. And this
Oh,
could be
really?
anything from a blood pressure medication. I mean, I've seen people go off their blood pressure or not even need to start blood pressure medication after, for example, starting a regular yoga routine that relaxes them. For things like cholesterol, a regular fitness program, swimming a couple of times a week may mean that you can get your cholesterol down low enough. But it has to be sort of an open-ended, not an open-ended, a closed-ended process where you make a deal with your healthcare provider and say, you know what? I am going to commit to going to the gym and do aerobic exercise for 4 hours a week. In 6 months, if my cholesterol hasn't come down, I'll go on the medication then. But
Well,
is there,
wow, I didn't realize that we could kind of do this kind of negotiating.
of course, absolutely. I mean, if you have, something like
Something,
diabetes, that
yeah.
might work if it's early stage diabetes or pre-diabetes. If you have a sudden, heaven forbid, diagnosis of cancer, that's not something that is going to be approved of. But most healthcare providers would be delighted to hear you say that you are willing to commit to a lifestyle change.
Wow. Okay, good to know. Is this a brand name or a generic? And then you said something about cost.
Yeah. Um, well, the first thing you want to ask is if is this a brand name drug or is it old enough to now be in a generic form? Generic forms, we actually talked about this last time. Generic forms, the drug is identical to the brand name, might have a different additive or whatever in it, but they are vastly less expensive. And if cost is a concern for you, then this is a question that you might ask. Is there an older drug that is a generic that might treat this condition equally as well? Because frankly, I can't afford, and we'll talk later about having honest conversation.
Yeah.
You can say, I can't afford a brand name medication. I just can't do it. Or is there a way that maybe the pharmacist, I could take half of the dosage and the pharmacist
Oh,
could split the pills for me? Is maybe there a way to do that?
never thought of that. So, to be clear, the generic drug is the same as the brand name, but the additives, the coatings, things like that might be different.
Yes.
Okay, good to know because I know people always question that. Well, maybe it's not quite as effective. Maybe they cut costs when they made it so it doesn't have everything in it that it needs to. So, okay, that's really good to know.
And in
Now,
Massachusetts, um, the well, on the they don't use prescription pads anymore, but on the prescription pads, it was the default is always the generic, unless the prescriber says otherwise, or there is no. So when the healthcare provider relays your prescription to the pharmacy electronically, the
yeah,
default is that a generic will be prescribed unless there is no generic, in which case the brand name will be prescribed.
I never knew that. Wow, okay.
Think
All
of all
the
this
stuff that
interesting dinner table conversation.
I actually did bring this up when I was talking to my girlfriends the other night. We all got together and I brought up some of the stuff that you and I talked about in our last episode. And you should have seen all the eyes. They were like, wow, we didn't know that. Big wide eyes. So, anyway, that's for listeners to go back and listen to the other episode too. Okay, next question. I have a hard time taking pills. Is this available in another form?
Simple question. Not most, many medications are available in a liquid, and you can take it that way. If it's a new medication and you can get it as a liquid, you can, the prescriber might say to you, because this is available in a liquid, you can sort of get used to the dose by taking half a teaspoon for the first week and then a full teaspoon for the second week. Liquid makes drug taking, medication taking easier for some people. There are some medications that are available as an inhaler as
I
opposed to
had
having
no
to swallow.
idea. No idea.
Yes, if you do have a hard time taking pills, this is a good time to tell your healthcare provider that.
Here's one that I always ask. Should I expect side effects? Which ones? And I ask that now because of those television commercials that we're going to talk about later.
Yeah.
Because I always I mean, I have to laugh and cry at the same time when I read that some of the side effects are death. Anyway, so should I expect side effects? Which ones? Why are we asking?
You always should expect side effects.
Really?
Well, you're introducing a foreign substance into your body. The likelihood of having a side effect is probably, I don't know, 80 to 85%. So although you might expect it, you're probably going to be very pleasantly surprised that you don't. The most common side effects for most drugs are things like nausea and vomiting, or the
Yeah.
opposite.
Yeah.
You might notice some diarrhea. You might notice your nose getting clogged up. The way these things are, when you see the ads, or even you read if you can get glasses that magnify enough to read the insert that comes with the medication.
Right.
They don't make up those side effects that could be seen. Those come from all the trials of the drugs. They calculate how many people in those trials noted those side effects. And they are required by law to list those possible side effects, keyword being possible. So your healthcare provider should, if I were a healthcare provider, my answer would be there is always a chance that you should expect a side effect. If you notice anything different after starting the drug that was not present before you started the drug, call me.
Really?
Yeah. If you've been walking around perfectly fine for, a year, you take a new medication, and about a week after you start taking the medication, you notice that you have aches and pains in your legs. There's a good chance, and you haven't been running a marathon,
Yeah.
there's a
Okay.
good chance that that might be related to the medication you're taking. And at that point is a good time to call the provider. But the key is if you notice something that hasn't been present since before you started taking the medication.
And
And,
then what?
if it happens on one day and it goes away, you're probably fine.
So what would they do? Probably recommend another medication.
They might change the dosage. They
Oh
might
yeah,
tell you
yeah,
to cut it
yeah.
in half. They might take you to take it at a different time of day. For example, if you were noticing a muscle cramp that was keeping you up at night, they might have you take it in the early morning. There are a number of ways to alleviate it. But yes, the answer is you should always expect a side effect. Expect it,
Okay.
but you may not experience it. The
Let's hope not.
possibility exists.
Okay, now here's one that I sometimes do ask, and I have to say, usually my medical professional will say that he or she, depending on who's in there at the time, isn't really sure. Will my insurance cover this medication? They usually kind
They
of
often
refer
don't
that
know.
back. Yeah, they often don't know.
Right. And it is up to you to, when you get home, or you might even be able to ask the person sitting at the desk if they can check it for you.
Oh,
But remember, if the order does get prescribed to the pharmacy and you later find out that it isn't covered by your medication and you're not comfortable paying the price, you do
oh, you mean
not
cover?
have to pick that up. You at the pharmacy.
Okay. You did
You can,
say if you find out it's not covered by your medication, but you meant insurance, correct?
yes,
Yes.
yes,
Okay.
yeah.
And then what would happen again if you found that out?
If you find out, if it gets transcribed to the pharmacy and you get
Yes.
home and you find out that it's not covered by your
Hmm.
formulary or your list of covered drugs by your company, then and it's already at the pharmacy waiting, you are under no obligation to pick up that medication. You are
No
not
kidding.
responsible for it. You can just call the pharmacy and say, you know what, it's not covered. I can't pick it up. And then you need to have another conversation with your healthcare provider. For the most part, for anybody who's on Medicare,
Yes.
most drugs will be covered.
This is kind of you might not know this either because, we know that you are not a medical professional. You've been a
Right,
medical researcher, that kind of thing.
right.
But what about over-the-counter medications that are prescribed for your wellness and that have been recommended that you take for the rest of your life? And a lot of those are really expensive.
They
Do,
are.
and does insurance often cover those? You're
No,
shaking
because
your
it's over
head.
the counter.
Oh,
That is not insurance coverable, but many people who are working have what's known as a flexible spending plan,
oh yeah, right.
which is a card that allows them to spend pre-tax money on medical products do cover over the counter. And I will say that some Medicare plans now, like mine, for example, does offer 25 to 50% off of over-the-counter products.
So
So
this is
that's,
probably another phone call we have to make
yes,
to our insurers to see.
yeah.
Okay. Okay, thanks. Okay, we have a few more questions in our long list. How long will I be taking this medication?
Okay. So the first thought is, well, for your lifetime, of course, but that's not always true. And antibiotics come to mind. Typically,
Right.
you are on antibiotics for the shortest possible period of time. So you may be taking this medication for only a week or two. Or you may be taking this medication, something like prednisone, for example. You may be taking it for 3 months, but the dose changes every 2 weeks as they try to wean you off of the drug. So it's important to know how long you'll be taking it and whether or not it's all right to stop it when you feel better, because this is a problem,
Oh.
especially with antibiotics. You go in, you have a urinary tract infection, doctor says, provider says, all right, we're going to put you on this for 2 weeks. After 5 days, you start to feel better, symptoms go away, you stop taking it. That's not the right way to take an antibiotic. That does not get rid of the bug that's causing whatever is ailing you. Um, the provider might say, um, I don't know how long you'll be taking this. It depends how you respond. Maybe we'll be able to, cut the dose back a little bit. But it's a good question to ask so that you can, or in the case of nitroglycerin, for example, how often will I be taking this? How long? This is a drug you take when you have pain. So you'll probably be taking it only when you have pain for the rest of your life. So unless you have a stent or something put in that fixes the problem.
Oh my gosh. You know, we're almost done with the list, and I just want to ask you a question. Do you think your healthcare provider would get kind of concerned about asking this many questions when usually you have 15 minutes or a half hour with him or her?
They might,
Okay.
but ask them
Then you
all at
deal with
once.
it.
Deal with it.
Okay,
Yep.
deal with it. That's a good
Yep.
answer. Is there anything I should avoid while taking this medication? You know, sunlight, grapefruit juice,
Yeah.
alcohol. Some of us know that, but I guess we should always ask that.
Right. Some of the statins we know they don't work as well if you drink grapefruit juice. And I remember once insisting that I have a statin be changed because I have grapefruit juice every morning and I love it, and I just didn't want to deal with it. Um,
And wait a minute. And you could do that? There was another one that you could take?
sure. I wouldn't have known that unless I asked, but yes.
Good, good.
Should I stay out of the sun for any reason? There are some drugs that interact badly with the sun, or, they all say don't drink and take this medication at the same time, but there are some drugs that have a lethal reaction if you were to take it with alcohol. So those are the things that you should ask. Again, this information is available other places, but it's always good to check with the prescriber. And these are things also that you could ask at the pharmacy if your 15 minutes was up before you could ask them all.
Oh, that's a good point. And I happen to have, I think we talked about it in the other episode, I happen to have a local pharmacy where I go because I know I can ask them anything and they will give me a real serious and well thought out answer. I feel really comfortable with them. We're almost at the end of our list. Are there any special instructions we should ask our provider? Like stay out of the sun. We talked about that. Don't
Right.
crush the medication.
Don't crush the medication. There are
What
some
happens? What happens if you do crush the medication? What happens?
it's not available to be absorbed through the gastrointestinal tract if you crush it because it's now in a powdered form as opposed to the GI tract being able to absorb it in the pill form. So you actually alter the structure of the medication. It's not all drugs, it's only some. The other thing is there's an osteoporosis drug that you take it in the morning and you have to stay upright for a period. I think it's an hour.
Yeah,
So
I've
no
heard
going
about
back to
that.
bed. Um,
What
some
happens if you
eating.
wait? What do you know? What happens if you don't stay upright when you take that medication?
I
Because I
think
know.
it's just all about the effectiveness of the medication. I'm not sure why. Maybe it would kind of make sense that it needs to go into the body gets absorbed better if you're sitting upright as opposed to lying down. I don't really know the
Oh,
answer
yeah,
to
yeah,
that.
yeah, yeah. That makes sense. That makes sense.
And there are several medications that they recommend that you drink a whole lot of water with them, like antibiotics, for example, especially for urinary tract infection. But again, that's something that you can certainly, the ones we're talking about later in this conversation are things that you can very readily ask the pharmacist or even the pharmacy technician.
Okay. And then another one, we have two more, I think. Help me decide the risk and benefits of this new drug.
Okay. So the healthcare provider says to you, this is an important drug to make sure that you don't get blood clots. And you learn that, okay, with this drug, I have to be tested every single week. I have to go to the hospital and be tested. And that's difficult for you. You don't drive. Is the risk of not taking that drug, does that outweigh the benefit of taking the drug? Or is there another drug that you can take that would still mitigate the risk, but allow you to still achieve the benefit of that drug? There are
Whoa.
some oral cancer drugs on the market that have pretty onerous side effects. And if it's going to help you live 1 month to 2 months to 3 months longer, only you can decide that. What will my remaining time look like on this drug, or should I not take this drug and just live out my life the way I've been doing it? So it's a very personal decision. Only you can
Right.
really determine.
Wow. That makes you really think, doesn't it, Jill? Yeah. Okay. Well, I wanted to ask what's in this drug, but I think we'll save that for another time. We're done with our list, but I wanted to add one thing because all my girlfriends and my husband said, ask about expiration dates.
Oh, great question. So every drug that you pick up at the pharmacy does have an expiration date on it. Hopefully, you won't come close to it with an antibiotic because you will have taken it all in the time
Yeah.
frame that is
Right.
recommended.
Right.
It's not like food. Food has an expiration date, and you can look at your cottage cheese that's a week past the expiration date and decide you really need to throw this away.
Yeah, right.
But that's not really the same with medication. Very few medications become toxic when they're past their expiration date.
Oh, good, good. Good to know.
Yeah, most simply lose effectiveness because the chemical composition sort of changes a little bit as time goes by. But there are some situations where taking expired medications can have bad health consequences, and some of those would be asthma inhalers. You really need to use
Oh,
those by the expiration date. Insulin, for example, needs to be, but whether it's in a vial or in a pen, that needs to be used by an expiration date. Nitroglycerin, thyroid meds, and blood thinners are all drugs that should not be used past their expiration dates. Anything else, pretty much, you've got probably 3 to 6 months left. And while we're talking about expired drugs, please dispose of them carefully. Do not throw them down the drain. Some of them have chemicals in them that aren't really pipe friendly. And please throw them
oh.
away where they would be out of the reach of children. Most pharmacies will take any expired drugs back. So,
Really? I didn't know that.
and most
Oh,
towns have an expired drug program.
yeah, they do. It's usually at the police department, I think. They
Yep.
have a collection device. But honestly, I
Yep.
didn't know that pharmacies would take back expired drugs.
Yep.
Oh, good. Good to know. I will be doing that. Okay, so you said in our conversation a little earlier these three words for us to remember when we are in our medical care provider's office. Tell the truth. Talk about that.
It can be embarrassing when you're in a place where you feel like you're not the most qualified party.
Right.
But your healthcare provider can't treat you if they don't know all of the information. And three of the most important pieces of information are, I can't afford my medication, so I'm not taking it. I take a long list of herbals and pharmaceuticals and homeopathic medications. They don't want to tell the healthcare provider about that. And the third is I'm finding myself being a little confused in
About
general.
what?
In general, I
Because they don't
don't
want to have a dementia kind of.
exactly. They don't want
Oh,
to say out loud that they are not as cognitively aware as they may have been. And the fourth thing is I can't really hear you very well. So you want to be honest and tell your clinician everything. They've heard it all. They won't,
yeah.
if they judge you, you need to change providers immediately. But this all fits into the whole picture. So be sure that you tell the truth. And if you're not comfortable or you're not comfortable, sharing these things, bring someone with you into the appointment that is more comfortable than you are. Maybe it's a child or a spouse or a sibling or whatever. Especially if you suspect you're having hearing or cognitive issues, bring somebody with you.
And is that always allowed? That's not a confidentiality
No,
problem?
not as long as you are the one who are doing the requesting.
I can see why some people would be embarrassed, not just to talk about the things that you just mentioned, but also about some of the things that they may be thinking is happening to their bodies. Because for so many people, getting sick, having a disease happen, is something that is often viewed as a weakness or something that might indicate that they did something wrong. How did I get this? The whole psychological part of illness. And I would think that some people would kind of want to hide that, even though you're in that office so that you can get help. I can see
Yep.
how it would be hard to admit that something is happening to you.
Yep.
What do you think about that?
I think that's why it's important. I know I go to a primary care practitioner who gives me half an hour, 20 minutes for the exam and whatever,
The other stuff.
and 10 minutes to have a frank conversation. And as I've gotten older, I've appreciated those 10 minutes even more. I know that she's, not going to judge me and that she will even empathize with me because I think we're kind of the same age.
Right.
But, for women especially who might be in the throes of menopause and they see a male healthcare provider, it can be embarrassing saying, I wake up sweating every morning and,
Yeah.
my libido has disappeared. That can be very embarrassing. So,
Sure.
but you do need to be honest because while healthcare providers may be excellent clinicians, none of them can read minds. So,
Right. But you brought up a good point. You are not the only person who has ever felt this way or had this thing happen to you.
right.
You are not alone. They've heard it before, they've seen it before. You don't need to be embarrassed or shy or upset about it. They know what to do. And you're
Yep.
right. They're not going to judge you. And if they do, it's time to find someone else.
Right.
I'm going to remember that. That's very good. And when I get my girlfriends together, we're going to talk about that. That's very good. We're almost at the end here, but there are these other things I want to talk about. Do you still have a little more time?
Sure.
Okay. You said speak up. If you can't, enlist the help of someone who can. You just mentioned that a little bit, but it was in a different situation.
Right. If you don't think a drug is working, or you've been talking to your friends, or you have any question about not even a new medication, an older existing medication, maybe you've read, on Apple News Plus that
Yeah.
there is some correlation. I'm sure these conversations are going on in pediatrician's office right now all the time about vaccines. But, if you've read something that is concerning you about a medication you take, speak up, say something about it. Maybe the healthcare provider hasn't seen it yet or heard about this particular controversy, but you have a right. Any medication you're putting in your body or injecting or however you're taking it, you have a right to ask any question you want or are concerned about. Even if, my daughter also has asthma, can I share my inhaler with her? Anything that's concerning you, you need to speak up about.
Ah, thank you. Okay. Use reliable information sources.
Oh, yeah.
Go right ahead.
We could go on for days about this. Reliable information sources Most of us are going to be going either to the internet or watching television. I would
Right.
consider the most reliable internet sources to be things that are published by the big, hospital corporations, Mayo Clinic, Cleveland Clinic,
Oh, okay.
things like that. If you're into reading scientific journals, good for you. But
Yeah.
those are reliable information sources. WebMD is a pretty reliable information source.
Is it really?
Yeah, it is. It's slanted a bit, but they are published by a very reputable source. So yeah, and it's mostly for consumers. So you'll ask about television. Um, those TV ads are probably more regulated than almost any other kind of advertising. They are,
Really?
yes, they are related by the FAA and a couple of, and FDA also monitors them. They have to say everything they say when they talk about side effects. Interesting note, I think I told you this, the USA is only one of two countries that allows direct-to-consumer advertising of drugs. The other one is
Yeah.
New Zealand, of all places.
Yeah, yeah.
Um, Doctors, providers have very mixed feelings about the TV ads because patients will come in and they'll have seen this on TV, but what they don't realize, the TV doesn't tell them that it's only for a particular group of patients and they don't qualify, then the patient gets all upset,
Mm,
whatever. So they're ubiquitous. You can turn them off,
yeah.
you can turn the volume down, but I would recommend that you not take your health information from TV ads, that you read it, print it off, bring it to the doctor, highlight something that looked interesting, and say, I read this. Can you ease my mind or can you confirm this?
Well,
Something like
most
that.
of those ads that you see on television say, talk to your healthcare provider
Right.
about this and see if blah, blah, blah is right for
Right.
you.
Or the one that cracks me up is
Yeah,
let your
right?
doctor know if you have diabetes. Well, presumably my healthcare provider knows that I have
Exactly. You're
diabetes.
like, wait, it's going the wrong way here.
Right.
Wait.
But that's just how regulated these things are, is that they have to say that. So,
Okay, thanks for letting us know because I think sometimes are they just saying that so that they can cover the base, all the
yeah.
bases and cover their whats also.
They
Yeah.
need new music too.
Well, I don't know. I kind of think that if I take some medications, I'm going to be out on the street dancing. I mean, that's what TV tells me. Oh,
Well,
but wait a minute. I probably will be.
I take
Oh,
one
that,
of those medications and I haven't danced in the 3 years I've taken it, so I don't know about that.
time to change that med. Okay. Okay, we're almost done. We're winding down. One thing that I think is really important, and I always say I'm going to do it, and I don't. Keep track and stay organized. What do you mean?
Most pharmacies have a system where they will alert you to when your next um, refill is due. If they
Really?
don't, oh yeah, my pharmacy, my provider orders everything on a 90-day basis.
Right.
So at the end of those 90 days, I get a notice from my pharmacy. But a lot of places don't do that. So
Ooh.
it's up to you to realize that on March 31st, you will be out of your medication. If it's something common, you're not going to have a problem going to the pharmacy. But if it's something
Yeah.
they have to order or they are out of stock in, they that may cause a delay. So keep track. The other thing is that a lot of people just take their medications every day straight out of the bottle. They pour
Mm-hmm.
what they need out. I really recommend using some kind of a pill container
Why?
because that way it's a record when the little Monday slot is
Oh.
empty. It's the reminder that you took the Monday night day and night pills. Whereas if I have to rely on my memory to remember if I took them out of the bottles, straight out of the bottles, I can't remember that.
Oh,
So
okay.
that's another way to stay organized. So those are kind of the two things that I meant was making sure that your refills are in place and making sure that you yourself know um, how much you need to take each day, set it up in advance, and then take them as you have set them up so that you'll know. There are also now systems that are available through Amazon and a couple of other places that will dispense your pills exactly as they are meant to be taken. So if you take 4 at night and 3 in the morning, you rip off the little tissue bag and there are the 4 there in the morning and at night there's 3 more there. So there are things like that too. Those are particularly good for people who may have some cognitive deficits that just
Yeah.
get confused. So that's another way to do it. But try to stay organized in some way.
Yeah, I figured out a little system for some that I have to take at a certain time. And I'm not going to divulge what that is or what they are. But yeah, I have put together a little system for that. And so far, it's working pretty well. Well, there's an awful lot for us to do, but you've given me such great information, Jill. Thank you so much for sharing your knowledge and your experience. I didn't realize that I would really feel more comfortable taking a list like this to my healthcare provider. I didn't realize I would feel this way, but now that I've talked with you and I understand how important it is, I'm going to do that. I think John, my husband, does that anyway. And, because he's a good list maker, but I think I'm going to do that. So what I'll say is, listeners, make your list of questions because you have a say in your medication experience. Right, Jill?
Right. And I just want to quick add one thing. If this is about a new medication that you're taking, try and talk it back to the healthcare provider before you leave. Say, okay, this is the new medication. I take it twice a day. I take it at breakfast. I take it at dinner. And I need to call you for for a blood test in 3 months. If you say it out loud and the provider nods his or her head and says, yes, that's exactly right, it will stay with you a little better. The talkback method always works.
I love that idea, the talkback method.
Yep.
Okay. Well, here's what I suggest. I suggest that you and I, we end our session now. Thank you so much. And then we get together a little bit later and talk back to each other about what our next one's going to be.
Sounds like a plan.
Bye, Jill.
Have a good day, everybody. Take care.
Bye-bye.
This concludes today's podcast. We're always looking for new ideas, so feel free to reach out to Judy Raper, Associate Dean of Community Engagement at Greenfield Community College at 413-775-1819 if you have an idea you'd love to share. Special thanks to the creators of Backyard Oasis, Denise Schwartz, Chad Fuller, Dennis Lee, and Christine Copeland. Have a great day.